Hi, thanks so much for coming over. Yeah, you know I've been studying and practicing hard for my upcoming nursing exam, and it really helps me to practice some physical checks on a real person, so yeah, I appreciate it. All you have to do is sit there. I'll guide you through everything. We're just doing a basic physical check today, checking your vitals, all the normal stuff. Okay, do you have any questions before we get started? I did change my hair up a little bit. Yeah, you noticed? Yeah, well, this is actually pretty close to my natural color, and a little bit reluctant to go darker, but I want to stop the bleach, so I thought, okay, I just did like a semi-permanent gloss just on the ends, and here we are. So yeah, it's a bit of a change. I was always bright blonde as a kid, so it's humbling kind of getting older and going darker. But we'll see. I think I'll do a bit of a warmer tone and lift it up a bit more. Maybe throw in a couple highlights towards the front, but yeah. Okay. Anyway, it's beside the point. So I have pink gloves for you today. And I just printed some notes out, so I'll be referring to those just so I can get everything right. Okay. So it says here I'm supposed to ask you a bit about how you're feeling. So how are you? Okay. Any pain or discomfort, concerning symptoms lately? Okay, try not to make me laugh. This is supposed to be professional. Okay. No, you're healthy. Good. Good. Well, that certainly makes it easier for me. Okay, so no headaches, dizziness, lightheadedness. Okay. Any recent illnesses? Okay. Any allergies? Okay. Do you take any medications? Okay. How long have you been on that one for, if you don't mind me asking? Okay, and that's working well for you. Good, good. Are you sleeping okay recently? Yeah. In the warmer weather, it can be more difficult, but in general, good. Okay, perfect. And eating and drinking is all fine, normal. Do you follow any diets? Okay, so no veganism or anything, just make sure you're getting all of your nutrients. Okay, perfect. So I was going to carefully observe. If you don't want to look at me, if that feels awkward, you can just stare past me. And I'm just going to take a look at you. Checking your skin tone. Good color. Okay. And good posture. Okay. You seem to be alert and hearing me. Okay. Good. Okay. I see. Fairly symmetrical. Alright. If you don't mind, I'm just going to take a quick check over your skin and your scalp before we dive into the tests. Okay, so just relax. And I'm just looking for any strange spots, scratches. You haven't had any injuries lately? Any trauma to the head? No. Okay. Good. Good. Okay, can you tilt your head down? I'm just gonna take a quick look at your scalp here. Okay. hair follicles look nice and healthy. No dryness. Do you struggle with any like dandruff or anything? Okay, okay. That looks very good. Just checking this side. And if you just tilt your chin up for me, I'm just gonna check under the neck or under the chin, because you might not be able to see like right below the ear. Okay. Alright, let me just take a look at your arms. Okay. Skin feels warm to the touch. Good temperature. Okay, perfect. And just gonna feel your head, okay? Alright. Checking the scalp. Feeling for any lumps or bumps. Yeah, this might be relaxing for you actually. Have you heard of ASMR? Yeah, so some people kind of like this personal attention. So if you feel relaxed, that's totally normal. Okay. Good. Good hair color. Nice shine. Okay. Perfect. I'm gonna note that down. Skin. Scalp. Good. Good hydration. And skin tone. You don't struggle with acne or any skin concerns. Good. No, you have very nice skin. Okay. Let's get into it. So I'm just gonna go through and check your temperature, pulse, and respiratory rate, blood pressure, oxygen. I'm gonna listen to your heart and lungs. Check your eyes, your face, ears, nose, throat, mouth, and your hands, circulation, strength assessment, and reflexes. Okay, yeah, it's really not for you to know, all for me, but just gotta remember for the exam. Okay, first, let's go ahead and check your temperature. Okay, I have sterilized everything before, trust me. If you could open up your mouth. Good, this is gonna go under your tongue and close for me. Good. I'll just hold it there for a moment. Okay. Perfect temperature, no fever. Sorry. Okay. Now if I could just hold your wrist, please. I want to check your pulse and your resting respiratory breathing. So just gonna feel here and count. And just breathe normally for me. Okay, very good. Pulse is normal, and I was counting your breathing as well, which is good. Also, just gonna feel on your neck for that pulse there. You are alive and well. Good. Okay. Perfect. Great. Moving on to your blood pressure. Are you known to have high blood pressure? Can be pretty common for a higher number to appear if you're at the doctor's office, if you're feeling a little nervous. So if it's high, we'll check twice. No problem. So just have this cuff here. I'll just wrap it around this arm, okay? Get the Velcro undone here. Okay. Just wrapping that around. It just goes on the forearm. Okay. Good. Okay. And just let me know if it's uncomfortable and I'll take it off. Here we go. Okay. Yeah, that was pretty fast. Just getting the reading. Good. Normal, 120/80. Very normal. Perfect. Let's take that off. Okay. Do you do cardio? Or what kind of workouts do you do? Yeah, good mix. Perfect. That's good. And you feel generally fit and well. I mean, you look it, so. Okay, good. Alright, let's check your oxygen. Sorry, my throat's a bit sore today. Okay, if I could just have your finger and just place that right in there. Good. Okay. Perfect. Okay, your oxygen reading is normal as well. Very good. Okay. You can relax. Okay. So, those are all the basic vitals. I'm just going to listen to your heart and your lungs now. My stethoscope. Okay. Right. So just moving your shirt collar here. Just going to listen to the front. Just breathe normally for me. Okay. Good. And over here. Good. And down here on this side. Good. Sounds healthy. Alright, and now can you take a nice deep breath in through your nose? Let it out through your mouth. Good. Same thing. Deep breath in. And let it out. Good. And again, deep breath in for me. And let it out. You're doing great. Okay. And one more deep breath in. And let it out. Okay, great. Now I'm just going to slide this on your back here. And I'm just going to listen back here. Just breathe normally for me. Okay, good. And one big deep breath in. And let it out. Okay. And can you cough for me? Good. And again. Good. Fantastic. Okay. Perfect. Heart and lungs sound completely normal. Okay. So, are you doing okay? Good, good. Alright, are you ready to move on to maybe the more invasive checks? I just need to check your eyes, your nose, and your ears, and all that. Okay, just let me know if you're not comfortable. Okay, but you're doing great. Doing great. Okay. So, to gently pull your eyelids, and I need to take a look up close with this light. Okay. Good. Alright. I'm just gonna pull this eyelid down. Can you look up for me? Yep. Good. 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 Okay. And I'm going to pull up here. Can you look down? Just checking right here. Good. Yep. Okay, and other eye. Just gonna pull down. Can you look up? Good. And pulling up. Can you look down? Okay. Great. Can you look at my finger right here? And can you look at my finger right here? Yeah, I know you're not used to seeing me so serious. Well, yeah, I'm training to be a nurse, so I'm gonna take things very professionally. Okay. Alright, I'm just going to examine a bit closer the backs of your eyes. If you just look behind me, please. It's okay if you have to blink. Just take a good look here. The optic nerve and the disc looking retina is clear. Everything looks healthy and normal there. Okay, just look that way for me. And just checking this eye very quickly. Make sure everything looks good and healthy there as well. Okay, let's do a quick pupil test. So just look straight ahead. Good. Good. Very good. You okay? A little blurry? Alright. And the other eye. Good. 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 Okay, perfect. And look at me again. Just doing a quick direct and consensual response. Checking direct. And the other side, consensual response. Very nice. And direct over here. And consensual response on the other eye. Perfect. Eyes are dilating correctly, properly. Okay. So let's do some peripheral vision tests. Okay, just look at my nose and tell me when you see my fingers. You can just say now. Okay. Good. 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 And stay looking here. How many fingers am I holding up? Good. Good. Perfect. Great. Good job. Excellent. Okay. You know your numbers. You can see pupils are working, so congratulations on that. Okay. Any double vision? I didn't ask, but yeah. Okay. Looks clear. Okay, good. Good. Alright, let's check your face. Can you smile for me? Frown. Good. Can you puff your cheeks out and let me push the air out? Good. Can you close your eyes really tight? Don't let me open them, okay? Can I touch? Yeah. Okay. Okay. Keep them closed. I know. Keep them closed. Good. 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 Okay. Can you raise your eyebrows? I'm not trying to make you look silly. It's for the exam. Good. And don't let me push them. Okay. Good. Can you wiggle your ears? Just kidding. Okay. I'm actually just going to feel your chin and jaw and your facial structure. Okay. Can you open your mouth and close it? Open again and close. Good. Okay, feeling the temples. Everything looks very symmetrical. I don't notice any muscle weakness with the right compared to the left. Okay. Good. So, let me take a quick look at your ears now. If you could just turn your head slightly. I'm just gonna check this ear. Okay. Alright. Coming up a little close. And just gently pulling the ear up and back so I can take a good look. Okay, not too much. Build-up of earwax. Do you clean your ears? Yeah, it looks like you do. Yeah, I don't think I've ever, obviously never looked in your ears before, but okay, very good. Can you turn that way for me? Thank you. Alright, let me check this side. Pulling the ear up and back so we can get a good look inside. Take a look. Okay. This ear looks healthy. Don't see any signs of irritation, infection. Just a good healthy amount of earwax. Okay. Alright, good. Can you close your eyes for me? Yeah, close your eyes. Tell me right or left on where you hear the sound. Where you hear the sound. Okay. Good. 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 Okay. Can you tell me when the noise stops? Alright. And again. And now tell me when the noise gets too far, okay? Yeah, when you can't hear it anymore. I'm gonna start really close and move out. Fantastic, okay? So, do you want to do a whisper test? Where I whisper some words or numbers into your ears? Yeah, okay. Let's do some words now. So I'm going to whisper from side to side and you just repeat the words that you hear. Okay. Butterfly. Chocolate. Chocolate. Okay. Squidward. Rainbow. Okay. Can you hold one nostril like this and just breathe in? Good. On the other side. Perfect. Okay. And no pain on the nose or in the sinuses. Okay. Let me take a quick look in your mouth. I'm just gonna press your tongue down. You open up. Good. Look and say ah for me. Ah. Good. Checking the back of the throat. You said you weren't sick at all. Okay. No, it looks healthy. I don't see any redness or bumps. Okay, I'm just going to check the gums just for a moment. Lift your lip up a little bit. Check the teeth. Okay, everything looks healthy. Okay, and can you lift your tongue up? Just take a look here. Okay, can you put it to the side? The other side. And then stick your tongue out as far as you can. Okay. Good, very good. I'm gonna do a quick swab, if that's okay. Yeah, I have to swab in my nursing exam, so. Alright, if you open up again, I'm just gonna go on the inside of your cheek, okay? Good, just right there. Okay, let's go the other side. And quickly at the back of the throat. Perfect. Send that off to our imaginary lab for testing. Okay, I'm just going to feel down your neck. You're being very patient. You are a patient. Okay. Feeling the glands right here. Lymph nodes. Good. Alright, holding your throat. Can you swallow for me? Good. Okay. Alright, and now if you turn your head, look that way. Any pain on this side? Okay, and just look that way for me. Any pain? Okay. Any pain at the back of the neck? Okay. Good. Alright. Let's move on. We're getting there. So I'm gonna look at your hands, check your circulation, capillary refill, just check your nails, stuff like that. Okay. And then I'll get you to do some strength tests. So may I please see your hands? You can just put them in mine. Thank you. Okay. Comparing. Color looks normal. Let's take a look at your fingernails here. Just keep your hands like this. Good. Do you do your own nails? No, they're very nice. I just stopped getting like builder gel at the nail salon. Going back to my natural nails. Yeah, I don't know, I'm in this phase where I just want to embrace more natural. Okay. Good. And I'm just going to pinch here. Checking capillary refill of each of your fingers. Good. 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 This hand. Good. Good, okay. Now doing some strength tests. Can you hold your hands like this? Fingers wide, and don't let me squeeze them together. Okay. Good. Now keep them like this and don't let me pull them apart. Okay. Good. You have strong fingers. Right. And make a fist. Don't let me open it. Okay. you shrug your shoulders. Don't let me push them down. I know we're almost done. Hey, I'm doing all the work, so just relax. Okay. Yeah, you're lucky. You're healthy, or else this would have been much more of an awkward exam if I had to diagnose you with something. Okay. Just feel down your arms. Good. And hold your arms like this. And don't let me push them together. Good. Same thing, don't let me push them apart. Good. Very good. And don't let me pull, okay? Yep, keep them firm. Good. And don't let me push. Good. 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 Okay. Should we check your reflexes? And then we'll be done. Okay. Just going to tap on your elbows, your wrists, and your knees here. So just relax on the chair in front of me. Okay. Just relax your arm. Good. Good. Yeah, I know it's not, you can't control it, but it's good. Proud of you. Okay. Other elbow. Good. 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 Okay, let's do your wrists here. Just a little tap. Good. And this one. Good. Okay. And now your knees, just scoot back so they're hanging. Yep. Okay. Good. And this one. Good. Good. Okay. I think that's everything. Let me check my notes here. Did I miss anything? So we checked your skin, temperature, pulse, blood pressure, oxygen saturation, heart and lungs assessment, face and cranial checks, ears, nose, and throat. Checked your mouth, neck, hands, strength assessment, reflexes. Yep. Everything is good to go. Yes, thank you so much again for coming to help me out. Would you say you felt comfortable during this exam? Would you give me a pass as a nurse? That's good. Glad to hear that. Okay. Yes, I feel much more confident now going into my practical exam. Okay. Of course. Yeah, you enjoyed it? Okay, glad to hear that. Thanks so much. Let me get these gloves off and maybe we can go catch a